Herzlich willkommen bei einer neuen
Welcome to a new episode of Thanatology Up to Date with Dr. Eberhard Rast, who is a medical doctor in Lucerne, Switzerland. Today I would like to talk about several psychological interpretation attempts that are often discussed when it comes to explaining near-death experiences. Dr. Eberhard, explanations that are often discussed are psychosis or delirium. What can be specifically explained in this context?
Well, maybe I should start by explaining what a psychosis and a delirium are. For people who haven't been in touch with these terms, and even doctors often conflate these terms, and it is difficult for them to keep them apart. However, they are two different things. Psychosis is the classical form of being crazy. People who suffer from a psychosis see a different reality that can't be corrected. Partially, they also hear acoustic hallucinations, meaning they hear something when they have hallucinations, and they hear them but other people never hear them. And they're totally convinced of this reality. And delirium means that somebody is confused, and this is also connected to the organs. What I mean by this is that this happens in the brain. Here we've got a problem in the brain, and we can oftentimes identify the problem. The people affected don't know where they are, in which situation they are, who they are, the date of their birthday. So all of these qualities are disoriented, so to speak. And oftentimes, they act in a different way. They also have optic hallucinations. So they see something. They see people in a room. For example, during delirium tremens, the withdrawal of alcohol, one of the typical elements is seeing white mice or an elephant. These are things that really happen. Well, that's a typical delirium, and they're also suggestible, meaning that you could show them a blank piece of paper and tell them, read this, and if you're persistent, they'd oftentimes start actually reading something, and they'd see something.
And what is the connection to near-death experiences here?
Well, a near-death experience is similar to a psychosis or a delirium, because you'd have to classify a near-death experience as a spiritual experience. And if you split this aspect of a near-death experience into categories, and also the aspects of a psychosis and a delirium, then you can compare them. However, it seems that the spiritual experience is on the other spectrum of a delirium or a psychosis. This already starts with the trigger, or the triggers themselves. A psychosis is triggered by a serious mental disorder, for example, schizophrenia or a drug. A delirium is a severe organic disorder. You oftentimes see them in people who go through a withdrawal, or older people who are already going through dementia and the brain doesn't work properly anymore. Then they might also take medication, or they might have had surgery or an electrolyte imbalance. So there's a trigger we can detect, either from a psychological or physical side. And when it comes to near-death experiences, or spiritual experiences in general, then we've got the average person, the average population. That's something we know. There have been done many studies regarding this. There's actually no difference between people who've had a near-death experience and the ones who haven't had one. They are from all classes and age groups. And then there's the characterization of the experience itself. As mentioned before, the delirium is characterized by a person being confused and mixed up. When we talk about a psychosis, the person has confused thoughts and doesn't have this connection to reality. This is also known as derealization or depersonification. For example, those people feel like, especially at the beginning, they are scared and they realize they're becoming crazy and that something isn't quite right with them. They don't feel real, and also the situation they're in, there's something that's not quite right. And when it comes to near-death experiences, we've got the opposite situation. It's hyper-real. That's something that's been described repeatedly, that it was more real than reality. We can't really imagine this, but that's how this incredible impression can be explained that is experienced by people that have had near-death experiences. And then the effects differ too. A delirium oftentimes has negative components like fear and confusion. When it comes to a psychosis, it has a negative aspect in any case. insofar that somebody might have a paranoia, a delusion, or ideas that can't be right and that inflict fear, or somebody's got exaggerated confidence and they think they're God, or something along those lines. And the effect of near-death experiences or spiritual experiences is generally positive, but in a quiet way. The person doesn't have an exaggerated confidence or overconfidence. So here, we've already got various categories or manifestations of these categories. And when it is about integrating this experience into one's life, then we find more of a resistance when it comes to a psychosis and delirium. When the patients are healthy again, they don't want to know anything about it, and oftentimes they don't know anything about it anymore. They've forgotten about it, and they don't really want to go back there again. And when a near-death experience was positive, which seems to be mainly the case, then it is the opposite. They would be happy to go back there, and it was an incredible experience for them. They also want to deal with it and integrate it into their lives. As long as they are not able to do that, they suffer, and not the other way around, when they deny it. And other after effects are connected to this. The after effects of a psychosis are always critical. You don't want in any case that this person suffers from this anymore. You'd give them medication in the case of schizophrenia, or you'd try to reduce the amount of drugs they take so this won't happen again. And a spiritual experience affects somebody in a positive way and not a negative way like a shadow. So when this integration works out, we see a change to the positive, which has been examined many times in people who've had a near-death experience. Such as philanthropy, they look for more meaningfulness in life and focus more on the essential things in life. And it is a positive assessment of this experience and seen as a gift.
So the differences are quite vast. So generally, these psychological approaches can't really explain near-death experiences.
In my opinion, no, because they are in two different spectrums of these categories.
Dr. Eberhard, thank you very much for this interview.
You're welcome.